Good afternoon and welcome back to Downing Street for the daily coronavirus briefing. And I'm delighted to be joined by Baroness Dido Harding, the Executive Chair of NHS Test and Trace. Before we turn to Test and Trace, let's go through the daily slides. If we have the first slide, please. This slide shows testing and the number back to Downing Street for the daily coronavirus briefing. I'm delighted to be joined by Baroness Dido Harding, as of the Executive Chair of NHS Test and Trace. Before we turn to Test and Trace, let's go through the daily bringing slides. The total number of tests that have been done in this country to 6 million. This slide shows testing and the number back to Downing Street for the daily and the number of confirmed cases, and the figures show that Harding, as of the Executive Chair of NHS, 197,000. Before we turn to total number of tests, let's go through the day, bringing the total number of tests of 291,000 done in this country to 6,409, and you can see that despite the vast increase in the number of confirmed cases, and the figures show that Harding, as of the Executive Chair of NHS, continues to fall. Before we turn to total number falling on that. Bringing the total number a little bit done locally yesterday, 409, and you can see that despite the vast increase in the number of confirmed cases, and the figures show the number as of the Executive Chair, where it shows the number of new admissions falling on that day, bringing the total number a little bit done locally yesterday, 409, and you can see that despite the vast increase in the number of confirmed cases. Figures this show where it shows the number of new admissions falling on that day, bringing the total number a little bit under 400 today, 440. Down the number of tests over 3,000 at the peak, so it's very good progress to see both of those numbers continuing to fall over recent days. If we turn now to the next slide, which shows the regional breakdown, again, as it has throughout this crisis, this shows that the shape is broadly the same in most regions of the country, and the downward trend persists. The latest figures down despite the number of tests over 3,000 at the reported number, so it's very good, bringing the total to 41,000 numbers continuing to fall over. Again, we can see this downward trend. If we turn now to the next slide, which shows the regional breakdown, and in fact, the number of deaths over the past week shows that the shape is broadly the same in most regions of the country on the 28th of March. In summary, we're working through our plan, and the plan and the latest figures working down the number of 3,000 that people hold so dear. So it's very good, bringing the total to 41,000 numbers. From the beginning of lockdown, the challenge has been not just how to get the virus under control, but how then to be able to again we can see this downward trend. If we turn now to the next slide, which shows the regional breakdown, and in fact the number of deaths over the past week shows that the shape is broadly the same in most regions ease the lockdown measures. And I was really delighted by the announcements that the Prime Minister was able to make yesterday, allowing these bubbles and the latest figures working down not just how to get those who live alone will be able to form a support bubble with the lockdown household. And I was really delighted by the announcements that the Prime Minister was able to make yesterday. It's very difficult allowing these bubbles and the latest figures working down not just how to get weeks. those who live alone really will be able to form a support bubble with a lot of that human contact. And I was really delighted that this is a big step forward. Prime Minister, and I know that the Prime Minister is very difficult allowing the bubbles and the not just really pleased at the very those who live alone really will be able to form a support bubble with a lot of that help us. And I was really delighted that this is a big step forward. Prime Minister, I know that the Prime are very difficult with allowing the bubbles and the not just really pleased at the very those who live alone really will be able to contain a support bubble that help us. And I was really delighted that this is a big step the virus, that we can control it and we can stop it spreading through our communities. In this plan to lift lockdown, test and trace is our radar, if you like. It helps us identify where the virus is and trace how it's spreading through the community. And you have your part to play. If you have symptoms, you must immediately self-isolate. I know that the very difficult with allowing symptoms and bubbles and not just spread. You must work. Those who really will be able to contain and identify who's through our community. You've been in close contact with. In this plan to lift if you're asked by NHS, test and trace is our radar to isolate. It helps us identify where the virus is and trace how it's spreading through the community. And you have your part to chain of transmission and to stop if you have symptoms of the virus. You must. I would even go with very difficult with allowing NHS test and trace. In this plan to lift you're asked by NHS test and trace is our radar chain of transmission to protect your loved ones. If you have symptoms to protect your community, I would even go with very difficult with allowing NHS test and trace. In this plan to lift you're asked today we're able to publish some of the initial statistics about the first to protect your loved ones. If you have operation of NHS test and trace. Baroness Harding will take us through these figures in a moment, but I just wanted to put them in a bit of context. They paint a positive picture. As we will see when we go through the figures, I would even go with that they represent just the first 7 days of this service, and yet it's already had a huge impact. The system if you have symptoms of NHS test and trace, and as we've both said from the start, we will keep getting figures in a moment. And I think you'll see from these figures why we are put them in a bit of that it will be world class. They paint a positive picture. I'm also delighted to say that we still have spare capacity. As we will see when we go through the figures, I would even go with that they represent. And I just want to take this moment before I hand over the first very formally on behalf of us all that it will be world to thank a positive picture to thank also the army of contact tracers to thank you that we still have to thank the NHS as we health see I would even go with that they represent and I just want to take including this moment before I hand over the first very formally on behalf of us all finally I want to thank you for your participation to thank also the army of contact tracers. The vast majority of people to thank the NHS as we health see and as we work. I would even go with that is maintained. And I just want to take and fortitude, including this moment before I hand it over. First, very formally, on behalf of us all. Finally, I want to thank you for your participation. To thank the army of contact tracers, vast majority of people, including the NHS, as we health see and as we work. I would even go with that is maintained. And I just want to take for a cause that they cared this moment before I hand it over. First, this very formally, on behalf of us all. Finally, I want to thank you for your participation. To thank the army of contact tracers, vast majority of the safety of the NHS, as we health see and as we work. I would even go with that is maintained. And I just want to take hand over to Baroness Harding. They cared this moment before I hand it over. First, this very formally, on behalf of us all. Finally, I want to thank you for your participation. To thank the army, vast majority of the safety of the NHS, as we health see and as we work. I would even
figures on the first 8,117 who had tested positive for coronavirus had their details contacted the final slide. Of those, 5,407, that's 67%, as the figures provided in the first and it's very encouraging that over 75% gave us the tested positive for the virus had their details really appreciate the final slide. Everyone. Also, 5,400 using that information, that's 6.7%, as the figures provided by 31,700 would be in the first semester, and it's very encouraging that over 75% gave us the 26,980 had their details were advised and agreed to self-isolate, which is 85% of all total contacts identified. Again, this was done speedily and timely. Given that it is still very early days, this is really encouraging. Responding positively and willingly, sharing information and self-isolating when needed. 7,000 people who otherwise may not have known, which is 85% of all total contacts identified. Again, this was done speedly and timely, sharing information and self-isolating when needed. Communities are now 26,000. I want to say thank you to all those people who otherwise may not have given us a list of 85% of all total and to everyone who has responded and agreed to self-isolate. Again, this was done speedily and NHS Test and Trace is a service for the public that works best as a partnership with the public. And our first week of data shows that this partnership sharing information and self-isolating together we know there are further improvements we can make to the system. The data shows that 4,800 85% identified and to everyone confirmed to us that they would self-isolate. This doesn't necessarily mean that these again self-isolating and some of NHS Test and Trace is a service for the public. Some of the people in this category were already been told by their friends to self-isolate. And our first week data shows that this partnership sharing information and self-isolating whether we know and there are further to understand why this is. Some of NHS Test and Trace is a service for the some of the people in this category I don't underestimate how tough this is by their friends to self-isolate. We're working hard to data shows that this partnership sharing
So thank you very much for your question, and I wish you the very best of luck for the rest of the lockdown, and I hope that we can bring relief to you as soon as possible. If we now turn to questions from the media, first question from Hugh Pym of the BBC. Hugh.
Thank you very much. As you've
thank you very much
explained,
for your question,
a majority of
and
people
I wish you the
that
very
tested
best of luck
positive, you did
for
get
the rest of the
contact
lockdown, and I
details
hope
from.
that we can
Are you a
we
bit
can
concerned
bring
that with
relief to you as
1/3
soon
of
as
people who
possible?
tested positive,
If we now turn to
reason,
questions from the
you
media,
couldn't get details
first question
of
from
recent
Hugh Pym
contacts from?
of the BBC. Hugh. Well, I would say that I think that
Thank
the
you very
system
much.
has worked well. And
As
to
you've
get thank you
explained,
very much for your question.
a majority of
and
people
wish you the
that
very
tested
best of luck
positive,
in
you did
the
get
rest of the
contact
lockdown,
details
and
from.
then to have
Are you a
the
bit
vast majority,
concerned that
85%,
with 1/3 of
the
people who
contacts
tested
that were given.
positive,
If we now
for
turn
whatever
to
reason,
questions
you
from the
couldn't
media,
get
I expect
details
first question
of
from
recent
Hugh
contacts
Pym
from.
of the BBC. Hugh.
Well, I would say
I think that
Thank
the
you very
system
much.
has worked well in the first
As
week.
you've
Thank you very much
explained,
for your question.
a majority of people
wish you the
that
very
tested
best of luck
positive,
in
you did
the
get
rest of the
contact
lockdown.
I think for
And
the
then to
first
have
week
the
of
vast
a
majority,
scale
85%
citizen
of the
service,
contacts
this is
We
good
now
for
turn to
us,
questions
and
from the
clearly
media.
it can
First
and
question
needs to
from
and will
Hugh
get
Pym
better.
of the BBC.
If you look
Well,
at
I would say
why we haven't got
I think that the
Thank you very
system
much.
has worked well in the first
As
week.
you've
Thank you very much
explained,
for your
contact.
question.
Some of it
majority
is,
of
we all have a
people
box
that
payment,
tested
which is
positive,
when we
get contact
take, I think, for
And
each
then
first
have
week,
the
right of a
vast majority
scale
of
citizen service. So it's easier before the
We now
test
turn to
rates,
questions
and
from the
clearly
media.
it can
First
and
question
needs to
from
and are
Liz
learning.
of BBC.
When you look
Well,
at
I would say
why
I think
we
that
haven't got, so we contact people 10 times during the post-contact. Of course, some of it is, we all have a box payment when we, and take, I think, for each first week to find a scale citizen service. So it's easier before the test. So I think clearly beginning and some of it needs to be learning. When you look at
I would say I think
we haven't got, so we contact people 10 times during the post-contact. Some of it is, we all have a box payment when we, and take, I think, for each first week to find a scale citizen service. So it's easier before the test. So I think clearly beginning and some of it needs to be learning. When you look at we haven't got, so we contact people 10 times during the post-contact. Some of it is, we all have a box payment when we, and take, I think, for each first week to find a scale citizen service. So it's easier before the test. So I think clearly beginning and some of it needs to be learning. When you look at we haven't got, so we contact people 10 times during the post-contact. Some of it is, we all have a box payment when we, and take, I think, for each first week to find a scale citizen service. So it's easier before the test. So I think clearly beginning and some of it needs to be learning. When you look at we haven't got, so we contact people 10 times during the post-contact. Some of it is, we all have a box payment when we, and take, I think, for each first week to find a scale citizen service. So it's easier before the test. So I think clearly beginning and some of it needs to be learning. When you look at we haven't got, so we contact people 10 times during the post-contact. Some of it is, we all have a box payment when we, and take, I think, for each first week to find a scale citizen service. So it's easier before the test. So I think clearly beginning and some of it needs to be learning. When you look at we haven't got, so we contact people 10 times during the post-contact. Some of it is, we all have a box payment when we, and take, I think, for each first week to find a scale citizen service. So it's easier before the test. So I think clearly
the more lockdown measures we can relieve safely. On Saturday for the social measures, on Monday for the retail measures. They are safe, they're part of the plan, we're working through our plan, we're sticking with that plan, and the plan is clearly working. We've seen this week that we're prepared to safe, take decisions in a cautious way, in a careful way, to make sure that we do it in a way that is safe. And the incidence of the disease continues to fall, and that gives us we've seen this week that we're prepared, able to make these steps, the steps that we've announced and confirmed, in a safe and secure way.
Thank you. One very quick follow-up, if I may. One of the key measures to how efficient test and trace may work is the speed it takes for someone who has symptoms to get tested and get a result, and for that result to get to the testing and tracing system. So far, the government has not made available key measures to understand how test and trace may work. When will you make that for someone who has symptoms to get tested and get a result, and for that result to get?
I'll ask Dido to take that question.
I'm happy to pick that up. So today we've published the time it takes for identify to that contact committing to self-isolate, and you can see that 75% or more are doing that within 24 hours. You're quite right that we haven't yet published the turnaround time for testing. Today we've published end-to-end turnaround to that contact to make sure self-isolated. You can see that verified 75%. And I know it's tempting to believe that within 24 hours. You're quite right that we haven't yet published the turnaround time for end-to-end turnaround. Right, but in order to join up, the point at which you order working hand to that contact to make sure self-isolated. You can see that verified 75%. I know it's tempting to believe that within 24 hours. Literally hundreds of different laboratories across the country, and several hundred different points of testing, and you're quite right that we haven't good enough the turnaround conclusions from it. So our commitment is to publish that data as soon as we and the UK Statistics Authority are confident that we can draw sensible conclusions from it. We aim to do that as quick as possible over the next few weeks, if at all possible, both at a national level and then ultimately at a local level as well. But in order to join up,
next question is from Andy Bell.
Working hand to that contact to make sure self-isolated. You can see that are confident that we can draw sensible conclusions from it. We aim to do that as quick as possible over the next few weeks, if at all possible, both at a national level and then ultimately at a local level as well.
At the moment, and what we've got to do is keep seeing
those.
To join up, next question is from Andy Bell. The numbers of people in the system and the proportion that we get to. Because we think that is the best way forward.
Could I just add that actually the thing that I most want to encourage is people to get a test. The proportion of people who are at risk of infection that we can self-isolate is people who are that contact. So make sure self-isolation encourage everyone to feel safe and confident that they should get a test if they have symptoms, and making sure that we bring as many people as possible who have got coronavirus into the test and trace programme is actually the number one thing we need to improve. The thing that I most want to encourage is, if you look at the other end, the fact that 85% of people who are being called who are at risk of infection that we are agreeing to self-isolate within 24 hours shows that the vast majority of the population is service. And if you look at the other end, the fact that 85% of people who are being called who are thank you so much for calling me, I was are agreeing to self-isolate now I'm not, because I don't shows that the vast majority of the population is
Go ahead, Andy.
Yeah, thank you. On that
if you look at the other,
which is that those people who are then contacted and told to isolate, but they're not told to get a test, or they're not tested automatically. You've just said, Secretary of State, that there is more capacity. Would it not make sense to not only say, right, you have to isolate, but to make sure those people are also getting a test?
Well, we've looked into exactly that, Andy, and taken clinical advice on it. And the clinical advice is that because this virus can incubate, sometimes for quite a long time, up to 14 days, if you got a test, it might give you a negative result, but you still are incubating the virus and come out with it later. So the clinical advice is really clear in that even if they'd still have to isolate for the full 14 days because of the way that this virus incubates inside our bodies. So that is unfortunately a matter of biology that has led to taking that decision. It's not about testing capacity. Thanks, Andy. Next question is from Laura Hughes of the FT. Laura.
You have rolled out antibody testing for NHS workers. Can I ask what you've discovered through those antibody tests? Are there people who are fine but didn't experience any symptoms? And if there are people who are getting this virus and not experiencing symptoms, how does that hamper the test and trace approach? Because clearly people aren't going to go and get a test or report themselves if they're not feeling anything different.
So the answer, I'll ask Dido to come in with the details, but the big picture answer, Laura, is yes, there are some people who don't have symptoms but do have the virus. And in fact, in the ONS study, we find that around 70 to 80% of people who test positive don't have symptoms. So that is quite a significant finding, and one of the important things about this disease, in the same way that asymptomatic transmission is one of the things that makes controlling this disease really hard and is novel for any coronavirus, and is part of this, one of the things that makes it so difficult. But there is a solution to the problem that raises, which is that the more people who do have symptoms, who we get into the NHS test and trace scheme, the more contacts we manage to isolate, so that whether they have symptoms or not, they are isolating for the period in which they would be infectious, and that breaks the chain of transmission. So precisely because of the nature of this virus, that you can have it without symptoms and still pass it on even without knowing you've had it, that's why the 14-day isolation is so important to break the spread of the disease. Dido.
Just add, the other thing that we are doing is in both the NHS and in social care, we are now routinely testing staff to see if they have the virus, the swab tests, as opposed to the antibody tests you refer to. There we're looking to find people who have the virus but don't have any symptoms. And as the Prime Minister confirmed yesterday, we are also now rolling that approach out to other high-risk, high-contact professions, like people who spend significant amount of time in an enclosed space with a large number of people, so taxi drivers, security guards, and there I think as individuals, if we have portion or level of antibodies you need to actually have immunity, and for how long you would have immunity. But at the moment, the science isn't there. So I totally understand everybody's desire to know if that cough or temperature they have.
To participate in one of these trials, like the one Dido's just described, to find out the link from having antibodies to whether you are then immune. If you're a member of the public, then please do take part in those trials. So far, we've had a very, very positive response to people being asked to participate in these trials, but they really are important because they increase our understanding of the virus and therefore what safely can be done to lift lockdown measures, get the country back on its feet whilst also suppressing the virus. Thanks, Laura. Next question is from Mesa Hall of the Daily Express.
Thank you, Secretary of State. If I can ask Baroness Harding, the people who are refusing to comply with self-isolation, what sort of reasons are they given for not doing so? Are your contract tracers trained to persuade them that it is their civic duty? And should these people frankly feel ashamed that they're not doing their bit to help fight this disease? And Secretary of State, if I could stray on to the issue of racism that's been dominating the news this week. A number of Labour MPs have written to the Home Secretary today to express dismay at her talk.
We would behave when we get that phone call or text message, because our communities will be depending on us doing the right thing.
And on your question about Priti Patel, Mesa, I think that, of course, Priti Patel was not wrong to talk of her personal experiences of racism. And I've seen this letter, and I abhor this divisive identity politics that's being levelled at Priti Patel. I'm incredibly proud to be part of the most diverse government in history. I'm very proud to be part of that with Priti and Rishi and Alok and Nadeem and Kemi and Ranil and James and Suella and all the rest. And we don't think that there's such a thing as the wrong type of BME. We think that people are equal. And that's what we need to see as a society, everybody seeing others as equal. And I just hope that the debates that are rightly taking place are debates that are all about how we can promote true equality of opportunity and see for the individual that they are. Thanks, Mesa. The final question is from John Walker from the Birmingham Post and the Newcastle Chronicle. John.
Thank you. As I understand it, the government's plan is to carefully reduce the lockdown nationally and to ask local councils to contain outbreaks in areas where there's a spike in cases. But councils I've spoken to say they aren't currently in a position to do this. They were asked to produce an outbreak control plan by June the 30th, so those aren't ready yet. And they don't have the legal powers to impose lockdowns locally. It seems the government is still looking at whether they need extra powers. So with shops opening on Monday, it seems that you are easing the national lockdown before the ability to impose local controls is in place. And I wondered if you could explain the thinking behind that.
Well, that's not quite the case, John, because we do have powers to do things locally if we need to take local action to control the outbreaks. Those powers reside with me as Secretary of State, and we've got a system in place so that local leaders, if they have an outbreak locally, are able to raise concerns if they need more action than power.
Secretary of State, will you publish or ask SAGE to publish the regional R figures that you're using, as they seem to be different to the ones that the media have seen and that we've been reporting so far?
Yes, this point about the regional R is really, really important to get right. There's more than 10 models that feed into SAGE and to their analysis of what R is across the country. And their analysis is that R is below 1 in all regions. One of those models had R above 1 in a couple of regions, but you've got to take all of the different science into account. You've got to look at the direct reporting of what's going on through the ONS surveys as well, which aren't models, that's actually measuring by testing on, boots on the ground, testing people to find out how many are positive. And as I say, the incidence of disease, the number of cases, is coming down. Which is really good. The amount of disease that there is in Newcastle and the North East is coming down. The amount of disease that there is in Birmingham and the West Midlands is coming down. And that is testament to the people of this country who are following the rules in the very large part, and now we can confirm are doing their duty by NHS test and trace as well. Thanks very much, John, and that ends today's daily coronavirus briefing. See you again soon.
Matt Hancock bringing that briefing to an end, as he said. Let's have a recap now of what we've heard in the last hour. The number of people who've died from COVID-19 has risen by 151 in the past day, bringing the total number of deaths of people who've tested positive for COVID-19 to 41,279. The Health Secretary Matt Hancock emphasised that if anyone has symptoms, it is their civic duty to get tested. Baroness Harding, who is the head of the UK's Test and Trace programme, went on to announce the testing figures for the first week between the 28th of May and the 3rd of June. She said that 8,117 people who tested positive were entered into the Test and Trace system. The tracing team reached 67% of those and asked them to provide details of those they've been in contact with. And of those contacts that the team reached, 85% of them agreed